This is Talk with Audrey. Welcome back. Well, I'll tell you what, there's enough stress and confusion in the world right now, especially when it comes to managing your health or that of someone else's. Prescription drug coverage can be yet another source of worry if you take a blood thinner and if you're concerned about a possible coverage gap. Well, joining me today, Dr. Daniel Zlott, a pharmacist and senior vice president at the American Pharmacists Association. We're going to talk about how local pharmacists can be a resource to educate patients and caregivers about the complexities of prescription drug coverage and how to navigate a coverage gap. Welcome.
Hi, Audrey. It's a pleasure to be with you today.
Thank you. So navigating that coverage gap is an issue for a lot of people. What role do you play in educating patients and caregivers about the complexities of prescription drug coverage?
Well, I like to think of it this way, Audrey. When it comes to getting the most from your medications, your pharmacist is really your best friend. So as a pharmacist, I help patients understand their medications. That means understanding what the medication is for, understanding how to take the medication safely and effectively, and of course, understanding what to expect while you're taking a given medication. I also help patients navigate the complexities of prescription drug coverage, and it's definitely complex, and it seems to get more complex every day. And then for patients who are maybe having some trouble affording their medications, I can often help step in and find some resources to help lower their out-of-pocket costs on their prescription meds.
Wow, I didn't realize that a pharmacist could help you find other resources that could help fill that gap. So I'm sure this is news for a lot of people. What are some of the obstacles that seniors are facing now when it comes to managing their health, and especially when the cost of their prescription drugs increases unexpectedly due to that coverage gap?
Yeah, absolutely. Well, first off, let's just call it what it is. Insurance coverage and prescription drug coverage can definitely be complex and confusing. Now, one of the things that makes it confusing is a feature, and I use the term loosely, of prescription drug plans called a coverage gap. And so when a patient hits a coverage gap in their insurance plan, their out-of-pocket costs for their insurance or for their prescription meds can increase suddenly and unexpectedly. And for some patients, that increase in cost can make it difficult for them to afford their medications.
So why does it? And I know that you're not an insurance company, but why does that happen? Like why?
Yeah, so um, the why is sort of, one of those great mysteries in life. But the reason it happens is that insurance plans have a limit on how much they'll pay for prescription drugs in a given plan year. And so once a patient hits that limit, the cost shifts from the insurance company back over to the patient, and so their out-of-pocket costs go up. And when this happens, unless patients are taking the time to first understand when that will happen, like at what amount that coverage gap begins, and then tracking how much their insurance has paid for their prescriptions over the course of the year, it can be a real surprise when that coverage gap starts to exist for the patient and their costs go up.
And of course, they probably don't give you a warning that you're about to reach that limit. And if you're a caregiver, that's just an additional thing you have to worry about and another thing on the list. So, how about navigating that coverage gap?
So when I have patients who hit that coverage gap, and even if they're not in a coverage gap, if they start to experience trouble affording their medications, one of the best things they can do is to talk to their pharmacist. I have a lot of programs that I know about that I may be able to get you linked up with that can help lower your out-of-pocket costs for your medications. And it's different for everybody. It depends on the medication you're taking. It depends on your insurance coverage, and it depends on your financial situation. And all of those things factor into what types of assistance programs or what types of help I might be able to get you linked up with.
So, if, for example, someone's taking a blood thinner medication and they hit that coverage gap, they might consider not taking the recommended dosage to save money. Do some people start cutting back on how much they use? And what's the danger of skipping or cutting back on the medication dosage?
Absolutely, Audrey. I see this all the time, and thank you for bringing this up. This is always one of my biggest fears as a pharmacist, is that when patients are having difficulty with their medications, they're not able to afford them. Instead of taking them, every day, maybe they take them every other day, or they cut their tablets in half in an attempt to stretch their prescription budget. And that can be really, really dangerous. So the example of blood thinners that you use is a perfect one. If you're not taking your blood thinner exactly as it was prescribed, you're placing yourself at significantly increased risk of experiencing a blood clot. And if you have a blood clot, that will then increase your risk of having a heart attack or a stroke. Obviously, both of those are very, very serious and something that no one wants to experience.
Well, I've heard of seniors cutting their pills in half, and it's such a difficult situation, one that shouldn't exist. So, what are some of the options that might be available to help lower the cost of prescription medication?
Absolutely. So, again, one of the very best things you can do is to talk to your pharmacist if you're having difficulty affording your medication, because we'll be able to put together that information about your financial situation, your insurance coverage, and the medications you're taking. We can then use all that to get you linked up with the right program that may be able to help lower your out-of-pocket costs. So going back to that example of a patient on a blood thinner, to kind of give you an example of one specific program I might refer a patient to, there's a great new website called feelingwhen.com, which is designed for patients who are on blood thinners and maybe having difficulty affording their medications. Maybe they just hit that coverage gap that we were talking about earlier. And so patients or their caregivers can go to feelingwhen.com and see if there's an opportunity to lower their out-of-pocket costs for their blood thinners.
There are probably a lot of people who are going to want to go to that website to see what their options might be. My guest has been Dr. Daniel Zlott, pharmacist and Senior Vice President at the American Pharmacists Association. We've been talking about navigating that coverage gap to help you keep your prescriptions in line and on track. Thanks so much for joining me. Great information.
Thank you, Audrey.